Health Service gives a data infected by hepatitis B. What is quite curious is the fact that the HIV AIDS, we have this antiretroviral, and that is for free. May I know from the minister, in view of the effort being made for the immunization to be free very soon, are there plans by the ministry to also add hepatitis B treatment to the category of HIV AIDS? Because, Mr. Speaker, they all depend on the antiretroviral for treatment. And one effect of this hepatitis B is that it leads to liver cancer, and the deterioration is faster than the most feared HIV/AIDS. All over, people are suffering, and it's not only through sex that people get infected. Even sweat alone, the food. Yes, food, drink is there. Body contact alone can cause the infection. So, Mr. Speaker, can the minister make that disclosure if there is any such plan?
Yes, Minister.
Thank you, Mr. Speaker. Mr. Speaker, my information is that it is very, very difficult to treat or to cure, if not impossible. But then when you get the symptoms, the National Health Insurance, as we have it at the moment, covers that. And it could be managed. It could be maybe. That is why I'm saying that it is not curable. Its treatment is very difficult as we stand now. And so, Mr. Speaker, having it as symptoms could be considered under the National Health Insurance as we have it at the moment. Yes, so when you have, every disease and its symptoms, you understand. And so, for example, if you go to the hospital and you have headache, and they try to manage the situation. And those situations are under the National Health Insurance as we have it at the moment. But to say we are treating or curing the hepatitis B on the National Health Insurance, that maybe I will have to recheck.
Speaker, with respect, I need to lay a good foundation for my respected colleague, the minister, to understand the situation. Mr. Speaker, when you get HIV and it is so tested and viral load is determined, the health authorities put you on antiretroviral drugs. It is free.
Honorable Leader, please address me.
It is free. Hepatitis B, and I want colleagues to pay attention to this matter because a lot of our constituents are being affected, and we need to push for government to take a position on this. The treatment and the management of hepatitis B is also done through the same antiretroviral drugs, but that one is not free. The same treatment, the same drugs that are used to manage HIV are the same drugs that are used to manage hepatitis B. And I'm saying that the data available at Ghana Health Service point to the fact that we have more Ghanaians being infected by hepatitis B than HIV. So there is a public health situation here. Unfortunately, the treatment of hepatitis B is not covered, as well as the vaccination. But the minister has assured us of the immunization bit. That one he has assured us that very soon. What I want to know from my respected colleague is that are there plans to put infected people also on the antiretroviral drugs for free? Because by the time the symptoms show, the person would have gotten to the advanced stage. Mr. Speaker, I have done an exercise in Winneba because when the data came out, it was so alarming, and a lot of those who were infected were saved by Safu Kantanka's drugs. He has some immune boosters, some liver boosters, and those who were on it, sometimes you go and test, and the viral load would have come to a very lowest level. Sometimes you cannot see it. It actually finds a way of getting out of your system, according to the data and the reports from the health professionals. But Mr. Speaker, because we do not have free treatment, people get it, they go test positive, and you know, liver infection, within 6 months, 8 months, a year, they lose it and they die. So if the minister can assure us that government will take steps to make the treatment of this free, the better it will be for our population, especially when the mode of transmission is quite high. The way people get infected and all, it's not just one way. So it's a very important matter that our colleague Mavis has brought to the floor.
Thank you, Leader. So,
I didn't go to greet them.
Mr. Speaker, my information from the experts indicate that the sets of treatment to handle HIV is completely different from that which is used to handle hepatitis B. And therefore, the two cannot be the same, with the greatest of respect. And so, Mr. Speaker, if it is the humble opinion of the leader that we should rethink, we should relook at that which will handle hepatitis B, that's a different argument altogether. Maybe that one we may decide to reflect on it. Thank you.
Very well. Yes, Leader.
Mr. Speaker, this period is not for debate, but once the minister put out some facts, it is important that a question is put for clarity. According to our respected colleague, the minister, he says that according to some experts, the treatment or the management of hepatitis B does not use, I use the word antiretroviral.
Honorable members, we don't need to spread our heads in this. He is on the floor. If you have a question, you can push. Don't worry. Let's allow him. Yes, Leader, please. Let's.
Mr. Speaker, is the minister in his answer telling this House that the treatment of hepatitis B
Leader, please address me. Don't just address the chair.
Is the minister saying that the treatment of hepatitis B does not rely on antiviral medication? Is that what he's saying? Mr. Speaker, that's my question. Mr. Speaker, I said, Mr. Speaker, with respect, I said, please, Mr. Speaker, this is a serious public health issue. That's some of the mistakes we make as political leaders. People in our constituents are dying. The percentage, the infection rate, according to Ghana Health Service, is about 10% of the population. That is an alarming figure. So if we are talking about 30 million, over 3 million of our populace are infected by hepatitis B, far higher than HIV. So let's not be partisan about this. What I'm saying is that in HIV, they rely on antiretroviral for treatment, and it's for free. So today, unlike some 20 years ago where people get HIV and they die, today, because of the management, the antiretroviral, people are able to take it religiously, manage their viral load, and they live a healthy lifestyle. I am saying that in the case of hepatitis B, which kills faster and leads to liver cancer, and the time you realize it, your liver would have been gone. Vaccination is not for free. For adults, treatment is not for free. Meanwhile, it affects the population in higher numbers than the HIV that we fear. People are surviving more on HIV than hepatitis B, and they are dying quietly. All I want to know from you, Honorable Minister, is that would you take steps to put hepatitis B treatment on the National Health Insurance Program and make it free as well?
Well.
Thank you, Mr. Speaker. Mr. Speaker, that will be considered. Thank you.
Well. Thank you. We turn to question 7B. Question 7B. And the question stands in the name of Professor Titus Kofi Bayo, member for Lambusi. Honourable member, I have the floor now.
Thank you, Mr. Speaker. Mr. Speaker, I rise to ask the Minister responsible for health practical steps taken by the ministry to ensure decentralization of interventional radiological services in the country in order to curb preventable deaths from diseases like stroke, heart attacks, and other acute medical conditions. Thank you.
Thank you very much, Honourable Minister.
Thank you, Mr. Speaker. I thank the Honourable Member for this important question, which highlights a critical component of our national strategy to reduce preventable death from cardiovascular and other acute medical conditions. Mr. Speaker, interventional radiology is a specialized branch of medicine that uses minimally invasive, image-guided techniques to diagnose and treat various medical conditions, including blocked blood vessels, internal bleeding, and organ disorders. It plays a vital role in the rapid management of emergencies such as stroke, heart attack, and other life-threatening conditions. Mr. Speaker, the situation inherited by the government was that only 2 public facilities were providing some level of interventional radiology and cardiac catheterization services. In addition to few centers operating within the private sector, this limited distribution of services constrain equitable access and contribute to delays in the management of cardiovascular and emergency cases. To address this gap, the Ministry of Health, in collaboration with the Ghana Health Service and other implementing agencies, the National Ambulance Service, and other development partners, has adopted a comprehensive plan to expand interventional and emergency services nationwide. First, in the area of capacity building, the ministry has partnered with the Ghana College of Physicians and Surgeons to establish a fellowship program, Interventional Radiology. Funding and scholarships have been secured to support training with attention to equitable regional representation. Continuous professional development programs have also been revised to include interventional techniques for radiologists, cardiologists, and emergency physicians. Additionally, telemedicine platforms are being deployed to provide mentorship and technical support to regional hospitals. Second, regarding infrastructure, the ministry has prioritized the expansion of interventional and cardiac care facilities. 6 regional hospitals are being upgraded over the next 2 years to include CT-guided intervention suites and portable ultrasound system for emergency vascular procedures. The Speaker, most notably, we have set in motion processes for the establishment of 3 new catheterization laboratories, known as cath labs, in selected tertiary hospitals to support interventional radiology cardiac procedures. This represents a major advancement in the equitable distribution of advanced cardiovascular care. Our targets include increasing the number of certified interventional radiologists from 4 to 20, establishing functional IR services in at least 6 additional regions, and reducing the median door-to-procedure time for acute stroke and coronary syndromes to under 90 minutes. Finally, Mr. Speaker, sustainability is being ensured through the integration of IR-related maintenance and consumable costs into the National Health Insurance Scheme, and by progressively expanding local training programs to develop a fully Ghanaian faculty by 2028. Mr. Speaker, the Ministry of Health remains firmly committed to decentralizing interventional radiology and cardiac intervention services as a key element of our national health strategy. Through targeted interventions in training, infrastructure, including the establishment of 3 new cath labs and strong partnerships, we are ensuring that life-saving, minimally invasive procedures become accessible to all Ghanaians, regardless of their region or residence. Thank you.
Thank you very much. Honorable Professor Bayoni, supplementary question.
Yes, Mr. Speaker. Thank you. Mr. Speaker, I asked this question because not too long ago, we lost a colleague, medical doctor, who needed catheterization in the Ashanti region and had to be flown to Accra. So my next question
Honorable
is...
Member, when you say catheterization, what do you mean?
That's what the minister talked about. It's an interventional radiological procedure that they can, through a wire, guide into the vessel to remove a clot. So he had a clot in the blood vessel, and it was blocking supply of blood to critical part of his heart.
Okay.
And as we speak, this service is not available in any part of the country outside of Accra. And so even from Konfanochi, the person could not make it to Accra and passed away. So there are people from my constituency in Lambuse, people in the Upper West region, the northern regions, who want to hear from the minister. How soon can these catheterization labs be made ready in other parts of the country? But while at it, I commend the ministry for the comprehensive package to decentralize these services so that Ghanaians everywhere stand a chance of surviving if they have an acute event. But I want to know how soon can these labs be established. Thank you.
Yes, Honourable Minister, how soon?
Thank you, Mr. Speaker. Mr. Speaker, as a matter of fact, government is at the concluding stage of the procurement processes. And therefore, I can assure you that very soon, 3 of the catheterization or cath labs will be established across various locations in the country. The difficulty, Mr. Speaker, is that it is my information that these equipment are not manufactured and put in the showroom for sale. It is based on order, and that's the difficulty. So we are at the concluding stage of the procurement process, and I can assure you very, very soon it will be ready.
Thank you very much. Yes, Honorable Dr. Kabilu.
Mr. Speaker, Mr. Speaker, I'm not a medical doctor. And Mr. Speaker, I provide this disclaimer because I'm following from the response the minister gave. Based on the background of this issue and the agency of that particular matter and the seriousness of that matter, I'm sure the minister will not be content in himself to say that very soon, without definitivity, without certainty, without as to very clear timelines. Even procurement has timelines. Mr. Speaker, I'm sure the people of Lambuse will not be happy with the minister's response that very soon. And the question was, how soon? And the response was that very soon, Mr. Speaker. I mean, that should not stand as an answer in this particular house. We want the minister to provide, just like he provided us in the case of hepatitis B, first quarter of next year. We want that certainty so that people can plan their life around that. And that is specifically the answer we are looking for. How soon? We want definite timeline, Mr. Minister. Thank you very much.
Yeah, Honorable Minister. Personally, until your explanation, I never knew that this is a very important question. So I share with Dr. Kabilu if he can give
Mr. Speaker,
specific times.
I entirely agree with you. It's an issue of emergency, and His Excellency the President has given clear directives, and that's why I told the House that we are at the concluding stage of the procurement. But Mr. Speaker, I've been following the development keenly, and just to share with you, I've already indicated that it is not manufactured and put at the showroom. It will take not less than 2 to 3 months to get the machine fully manufactured. And it's not being manufactured in Ghana. It will have to be on the sea to travel into the country. Give yourself about 1 to 2 months. And so if you add, give or take, we are talking about not less than 5 months. And so, but I didn't want to, Mr. Speaker, but that is the explanation, Mr. Speaker.
Yes. So we will now turn to the normal questions. We will turn to the normal questions, and we will come to Dr. Kingsley Ajimai, member for Buakwa South, on question listed as 86. Dr. Ajimai, you have the floor now.
Thank you very much, Right Honorable Speaker. I seek to ask the Minister for Health what approach the ministry is taking to coordinate data collection, analysis, and dissemination of research to generate evidence-based health policies. Thank you.
Yes, Honorable Minister.
Mr. Speaker, I thank the Honourable Member for the question, which highlights the importance of data governance and research in shaping evidence-based health policy. The Ministry of Health recognizes that the healthcare is a data-intensive sector and that timely, accurate, and secure data are essential for sound policy and effective service delivery. To this end, the Ministry is implementing a comprehensive strategy to strengthen coordination in data collection, analysis, and use across the health sector. First, we are automating data capture at all levels of care to replace manual entry, reduce errors, and ensure timely reporting. This digital transformation enhances accuracy and efficiency while freeing health workers to focus on patients' care. It also ensures that our systems are robust, interoperable, and locally managed, so the ministry maintains full control of medical data without dependence on external vendors. Second, we are establishing a national health database under the Health Information System Strategic Plan to integrate data from the Ghana Health Service, the National Health Insurance Authority, and other agencies into one reliable repository for policy, planning, and research. Third, we are harmonizing health data and metadata across all 29 agencies to ensure consistency and interoperability, and are collaborating with the Ghana Statistical Service to align health data with national demographic information for more accurate analysis. The ministry is also partnering with universities and research institutions to apply advanced analytics and big data tools, enabling real-time insight for planning, resource allocation, and performance monitoring. Complementing this is a knowledge translation platform which ensures research findings are systematically synthesized into national policy recommendations. Mr. Speaker, through these efforts, the ministry is building a modern, secure, and integrated health information ecosystem that supports a real-time decision-making, safeguards data sovereignty, and reinforces our commitment to evidence-based health policy. Thank you, Mr. Speaker.
Thank you very much. Yes, Dr. Ajimai.
Thank you very much, Minister. I might have mixed it. Forgive me if I did. My question was in threefold: collection, analysis, and dissemination. Dissemination is very key, but in your response, I didn't hear a response on dissemination of this data. Can you please point to the various paragraphs that answers the question on dissemination? Thank you.
Yes, Minister.
Mr. Speaker, if the honorable member will come again, dissemination as in the analysis we get from the data gathering, what we learn from it, and disseminating that information, or what do you exactly mean by dissemination?
Thank you very much. You have collected data, you've analyzed data. How do you disseminate that data to transform into policy evidence or evidence policies that will require in the health sector? Thank you.
Yes, Honorable Minister.
Mr. Speaker, what data does to policy is, Mr. Speaker, I'll give you a practical example. It's out of data that we realized that about 43 to 45% of our mortalities in this country are attributable to NCDs. Is data. So once you have this data, as a government or as a leader, it informs your policy, hence the establishment of Mahama Cares, to deal with the issues. And so when you know that there is a problem out of the data, maybe in some cases, in some cases, you have to embark on sensitization drive. How you sensitize the people to, maybe if it's for example, if it's an outbreak, if you have a data on outbreak, then you have to roll out your public health strategies to sensitize the people on how they can prevent themselves from that particular outbreak. And so that is how the analysis or the data collection informs decision makers to be able to govern well. I thank you for the opportunity.
Yes, Doc.
Thank you very much, Right Honorable Speaker. I think I will engage further on the response given on the dissemination. I have a quick follow-up. Again, in consonance with best global practices, you realize that research calls are usually announced so that we reduce biasness and other issues that comes with it. The response, however, was lacking on mitigating strategies to reduce biases to research. Can the minister consider such issues that are usually in line with best practices when it comes to research calls? Thank you.
Yes. Is there a question or you?
So no, it's not an admonishment. The question is, what strategies have they put in place to mitigate research biasness with regards to usually best practices on research calls?
Yes, Doc.